One thing was certain when the truck filled with medications donated by the Watson Children's Foundation arrived at Ankeraheri Clinic. Lucrece Watson's vision that we can save some would be a reality in Thomasina, Madagascar in September 2015. The truck was filled with vitamins, antibiotics, medications that prevent postpartum hemorrhage for laboring mothers, and medications that treat infections in infants and children. All these and more were part of the shipment for CRMF's Saving the Lives of Mothers and Babies programs. No wonder Clinic Director Dr. Albert and CRMF Project Director Dr. Carol Egner were all smiles.
Well, we'd like to thank the Watson Foundation for providing so many meds and supplies for us for our trip in Madagascar, and the clinic that we work at here in Ankeraheri with Dr. Albert.
Even the Regional Ministry of Health issued a formal letter of gratitude to CRMF and its sponsors. To understand why this project is so important to mothers and babies in Thomasina, it helps to know a little about Madagascar. It is one of the world's poorest countries, with more than 70% of its 23 million people living on less than $1 a day. The healthcare system, in particular, suffered from years of political chaos as the nearly bankrupt country repeatedly cut the budget for health services. For example, the health budget for 2012 was half of what it was in 2011. The poor suffered disproportionately from inadequately funded health care. Recent reports indicate that maternal and neonatal mortality rates are rising.
In 2015, there were 3,500 maternal deaths. That means about 10 women died in childbirth each day.
More than half of the deaths were due to hemorrhage, hypertension, and infection. In 2015, there were 40,000 deaths of children under 5. Pneumonia, diarrhea, malnutrition, and infections caused most of the deaths of those older than 1 month. 16,000 of those deaths occurred during the first month of life. Asphyxia and premature birth accounted for most of these neonatal deaths. What has CRMF's Saving the Lives of Mothers and Babies project accomplished since 2011 to improve this sad situation? The leadership of obstetric specialist Dr. Carol Egner has been critical. And so has our partnership with Ankeraheri CSB2, a clinic in urban Thomasina with a busy maternity wing. In 2011, we upgraded Ankeraheri's maternity wing with new equipment and provided running water and essential medications and supplies. But the core of the program was Dr. Carol's teaching. One of our goals in 2011 was to train local midwives in Thomasina to reduce postpartum hemorrhage, the leading killer of new mothers. We used birthing simulators in the classroom. There, midwives learned how to recognize the signs of hemorrhage and, in treating it appropriately, to save a laboring mother's life. They had the opportunity to practice skills in suturing, essential to preventing infection when episiotomy is needed. The midwives began to learn about ultrasound technology and that it could be used to identify impending problems. To decrease infections in the umbilical cords of newborns, the midwives learned to use disposable cord clamps instead of unsterilized sewing thread. Every student in that first class received a certificate of achievement.
Data we gathered in 2011 showed us that many Ankeraheri newborns had to be resuscitated at birth. So in 2012, we introduced Helping Babies Breathe into our curriculum. It is an internationally recognized guide to newborn resuscitation.
Dr. Carol's observations led her to expand the curriculum. Midwives learned to recognize and respond to other causes of maternal death, hypertension and preeclampsia.
Meanwhile, CRMF medical volunteers learned an important lesson. Mothers who came to our free clinics from rural villages and urban slums wanted the American team to care for them and their babies too.
There was a high demand for obstetric care and ultrasound services for those who had no access to Ankirihiri Clinic. Rural patients walked for hours to take advantage of clinic services and to receive free medications for their infants and children. In 2013, the Ministry of Health asked CRMF to expand the program. They wanted midwives from maternity clinics outside the Ankirihiri neighborhood to benefit from Dr. Carroll's classes and mentoring. By 2013, it was also apparent that the midwives who began their training with us in 2011 were capable of training others, not only in basic ultrasound skills, but also in teaching the essentials of newborn resuscitation. This marked the achievement of another hoped-for goal, the ability to pass on life-saving skills to local practitioners. And the curriculum expanded yet again to include topics such as handling critical care issues in pregnancy. It also became clear to the medical team that modeling how to assess well-being of the newborn was crucial to ensuring the survival of infants in the early hours and days after birth. Newborn assessment became part of the program. By 2014, Dr. Carroll and her team had also become innovative in teaching important techniques and creative in providing essential tools in a resource-poor environment. She taught the skill of vacuum extraction of the newborn by using translator Darwin James as her model. She searched the internet to find an inexpensive way to create the internal balloons that stop postpartum hemorrhage. Dr. Carroll's midwives can now make these for pennies, using a condom and string, a catheter, and syringes. Such a device costs hundreds of dollars in the United States. In 2014, we also began giving every clinic patient a supply of iron and vitamins to help alleviate, in a small way, the widespread anemia and malnutrition that lead to stunted growth and impaired development. By 2015, more than 100 midwives, nurses, and doctors had participated in Saving the Lives of Mothers and Babies classes and mentoring. In 2015 alone, our clinics offered more than 100 obstetric consults and treated more than 200 infants and young children. Thanks to the Watson Foundation, in 2015 there was medicine for Ankirihiri Clinic and medicine for the poor who could not reach that clinic. 2 2015 vignettes serve as metaphors for our work. Our OB intern, Dr. Sashana Gordon, bag-masked a critically ill newborn, taking him from Ankirihiri to the local hospital riding in a tuk-tuk, a mechanized bicycle. He survived. That same day, a mother brought her critically ill infant to our free clinic. We sent her immediately by taxi to the local hospital. She died within an hour. Saving the lives of mothers and babies has come a long way since 2011. We have known the joy of success and the pain of loss. We have known accomplishment and disappointment, and we have learned that cultural change is a slow process. But every year, we again learn the truth of these words. You cannot save them all, but you can save some. Those of us committed to saving the lives of mothers and babies could not agree more.